Good morning, it's Dr. Garrett, and today I want to talk to you about the PRP pathway. This is something that's becoming more and more prevalent in practices, cosmetic, aesthetic, but it's actually been utilized for a very long period of time in other aspects of healing within the body. So we've had our orthopedists using it, we've had our orthodontists using it, and we've found that it does an amazing job at being an autologous type of healing or same body healing. Now, this lecture is geared more towards providers. However, if you're a patient watching this, this is going to give you a pretty in-depth view of how PRP works. But for our providers, this is going to show you how these things work and how if one thing is out of balance, it can throw off the whole cascade and you're not going to get the best results for your patients. So, how does PRP work? So essentially what you're doing is you're drawing your patient's blood, you're spinning it down, you are pulling off that platelet-rich serum off the top of it, you are then spinning it down again and concentrating that down. You're going to discard the platelet-poor plasma and you're going to keep that platelet-rich plasma. You are activating this either with a calcium or a sodium bicarb to help the body or to help those platelets start to want to work faster and better. So how does this work within our body? PRP is platelet-rich plasma. A platelet is a cytoplasmic fragment of a megakaryocyte that is formed in that bone marrow. So it's this giant cell, and it's broken off into 1,000 different things. And one of these things is the platelets. And these platelets are responsible for healing, for wound help, and with maturation and growth of new tissues. So these platelets will contain over 30 different bioactive proteins. These have the foundations of hemostasis and tissue healing. These platelets are going to release growth factors, cytokines, extracellular matrix modulators, and these are going to be what promotes that revascularization or that neoangiogenesis. It's going to help with the restoration of that damaged tissue, and it's going to do this through the induction and proliferation of those fibroblasts. So we're putting it into the area. The body sees, oh my gosh, we've got all these platelets flooding the area. They're activated, meaning there must be a wound here. So let's go ahead and heal this. So it starts along what we call a healing cascade. So let's take a look at this healing cascade. So let's say that you went out walking in the woods and you got a cut along your leg. So with this wound, what the body is designed to do is the platelets are going to go and plug the wound. They're going to release those alpha granules. These are going to contain those polypeptides such as fibrinogen and protease inhibitors that tell the body, hey, we've got a problem. Now what's going to happen are the neutrophils are going to come in, and what they're going to do is they're going to start clearing the debris, the germs, and the damaged cells. So important that you understand this, because within tissues and joints that we're injecting this in, that white blood cell in that healing and that inflammatory response is vitally important for getting rid of the garbage that's already there before new tissue can grow. So then we're going to have the new growth of tissue, or the proliferation. Several days later, there's the creation of granulation tissue as the blood or the bruise is replaced. The fibroblasts are going to play a vital role in the connective tissues as they produce more protein, collagen, new capillaries, and new cell growth. Now we're going to have that maturation or remodeling stage. So this is where the body says, all right, let's clean up the mess, seal up the hole, and call it done. So that connective tissue is strengthened as the original collagen that was there first, that was created by those fibroblasts, is slowly replaced with stronger collagen. And think of collagen as that mesh framework that's going to hold something up. And this is going to link and arrange itself so that the tissues are stronger. Now think about that in the tear troughs, that area where those cells just become so damaged and so friable and so dark because we don't have that blood vessel there. So this is going to help make that tissue stronger, more vibrant, more radiant, more vitality will be within those cells. So what's in it and how does this work? So with our platelet-rich plasma, we have growth factors in there. And so these are going to be things like our lipid creators, our neurotransmitters, different proteins like cytokine. We're going to have things that are going to create collagens, such as our fibroblasts and our keratinocytes. We're going to have our thrombocytins, which are going to help to engage with the healing process. You're going to start to get blood vessel formation. And then remember, we're going to get that new cell growth in that area. It is specific to that area. So if I draw blood and I get the platelet-rich plasma ready to go and I put it in the tear troughs, it's going to help with that tissue. If I put it in an elbow joint, it's going to help with that. If I put it into a muscle, it's going to help with that. So we're going to get that mitogenesis via mesenchymal cells, through fibroblasts, through osteoblasts, which are bones, tendinocytes, which is going to help with our tendons, and with vascular smooth muscle regrowth. We're going to get that new cell formation with that. And so that's why platelet-rich plasma is so vitally important. So it's really also important that we talk to our patients about when you're going to see the results. Otherwise, you're going to have very unhappy patients. So PRP goes by the rule of 3. Within 3 days, that PRP has been reabsorbed into the body. You need to remind your patients you're not going to see it. It's very insidious, very slow onset. So I inject it up underneath the tear troughs. That's going to be reabsorbed by the body. And then at day 3, they're going to say, what did I waste my money on? But it's going to start working. Within 3 weeks, our body has started the process of creating new tissue, collagen, elastin, and that neoangiogenesis where we're getting those new blood vessels through there. At 3 months, we're going to see the final result of that one treatment. So remember the rules of 3 and explain those to your patients. Otherwise, they're going to be calling saying, I don't see anything, I wasted my money, this didn't work. Now, with that being said, we need to make sure our patients understand how we can make platelet-rich plasma work better within the body. Rule number 1, we have to have inflammation. If you do not have that healing cascade with inflammation, this is not going to work. So think about that for a moment. If you don't have inflammation, PRP is not going to work. If you're taking NSAIDs, such as aspirin, ibuprofen, meloxicam, Mobic, naproxen, Aleve, these are anti-inflammatories. It stops inflammation. If you're taking oral steroids, stops inflammation. If you're taking different herbal supplements for inflammation, like turmeric or cumin or fish oil, it stops the inflammation. So typically I said, if you absolutely can, do this months ahead of time. But if not, at least 2 weeks prior and at least 3 weeks after. Get off of those anti-inflammatories, because this is the vital part of that healing cascade that's going to help with the tissue growth, to help with the autologous filler, to help heal up the joints, the tendons, the ligaments, all the smooth muscles that we need this to heal. Now, I also tell my patients this is autologous. And it's really important that they understand, because I cannot tell you how many times I've had patients say, well, whose PRP are you using in me? It's your PRP going into your body. I'm drawing your blood and putting it back into you and only you. So how can you make your PRP work best? You need to control the blood sugars. So at least 2 weeks prior, I'm getting them on a really good diet. I'm telling them, I want you to eat your green leafy vegetables. I want you to drink your water. Your job is to make this filler or to make this healing cascade the best that it possibly can be. So to control the blood sugars, throw them on some supplements, cinnamon, chromium, berberine. This is going to help control those blood sugars for a really nice period of time. Side note, berberine, if you take it at night, can cause really crazy dreams. So side note. All right, we also want to improve our stem cells 2 weeks prior. So we want to make sure we're getting good supplements in there that is going to help with those growth factors, to help with that mitogenesis, and to help with all of this. So sometimes we're doing a lot of B vitamins. Sometimes we can do some IVs to really kind of push this through. And NAD is really, really great for the body. But, you know, you can tell your patients these are also going to help, whether you do it through an IV, through injections, or if you're doing the supplementation. Antioxidants, at least 2 weeks prior. We need that oxidative stress to go away. We need the mitochondria to be able to function the way that they're supposed to in order to help with this healing cascade. So you need to make sure that your patients are getting plenty of antioxidants. Green tea, resveratrol, polyphenols through your berries. So tell them a cup of berries every single day. Blueberries, blackberries, strawberries, cherries, cranberries, currants, whatever. You need a cup of berries per day. Vitamin C, this is an antioxidant. We need to make sure that our patients are getting all of these antioxidants so that we can help with the antioxidant and that fixing that oxidative stress prior to using this PRP. And this is going to give the best outcomes for your patients. Now, just so you have an idea of where we can treat and how much we charge at Empowering Health, let me kind of give you the rundown of the numbers here. So the hair, we really like to use this to help regrow hair and to stimulate collagen production within the scalp. So typically we are doing 4 treatments and we charge $1,200 for those 4 treatments. We usually add in either microneedling or PDO threads, and then we set them under the Soluma or the red light therapy for about a half an hour just to help with that tissue growth. You tend to see those results at 6 months, but I want them to do those treatments spaced 4 to 6 weeks apart. Now, with the PRP for hair restoration, we are activating this with sodium bicarb. Now, the face. There are so many places you can use it cosmetically or aesthetically in the face. Microneedling with PRP. Sometimes this is referred to as a vampire facial. Now, I did train under Dr. Charles Reynolds. I went down to Alabama, met him, and trained in his office. But in order to call this a vampire facial, you have to be within his company, and it is a trademark name, so you have to be trained underneath him. But just so you kind of know what people are talking about. Here at the office, we charge $450 for this. There's less swelling, less redness, you get improved healing, and you see the best results at that 6-week mark. PRP for tear trust. This is my go-to for tear trust. I find that it does such a good job. Now, I will put filler in some patients, but for the most part, we start with PRP, or I do filler basted with PRP. We charge $250 for tear trust. They're swollen for a day or so. There's limited bruising because we're using cannulation. I'm either coming in from the side or coming up from the bottom, depending on where their ligaments lie. And we just fill in that area. This will also help with the dark circles because we have that neoangiogenesis occurring where we're getting in the new growth of the blood cells. The PRP facelift. So this is going to be injecting PRP into a lot of areas across the face. And we're using this in conjunction with a hyaluronic acid filler just to give you a more subtle overall look. So sometimes we're putting it above the eyebrows, we're putting it in the cheeks and the jawlines, in those lateral oral commissures or those marionette lines along the nasolabial folds. And then we're using filler just to kind of help balance that out and give that rejuvenated look to the face. The great thing about the PRP facelift is it gives the skin a very beautiful glow as those nutrients are getting to the areas that they need. Now, vaginal rejuvenation. If you are up underneath Dr. Charles Reynolds, then this is also known as the O-shot. But essentially what you are doing is you're placing a cc of the PRP into the clitoris. What this is going to do is this is going to improve the sensitivity. It's also going to help with collagen stimulation, so it's going to move that clitoris out of that clitoral hood so that there is better friction against it. We are also placing about 4 cc's up into that anterior vaginal canal. And what that's going to do is that is going to strengthen that matrix and make like an analogous mesh along that urethra, which will help hold the bladder up and help with urinary incontinence. It also helps with mucus production. So this is really great for your postmenopausal women who have lost that estrogen and are now noticing vaginal dryness. I also can place this in episiotomy scars to help relax out the tissue and to help with that tissue growth. We can mix this with filler for a labial wing lift so that we can really rejuvenate the vagina and the vaginal area. Now, best results are seen at 3 months. However, especially with the urinary incontinence, they can have instant results due to that inflammation and swelling. Not painful at all. Everybody's like, oh my gosh, this is gonna hurt so bad. You can use a topical lidocaine. You can hold ice to the area. Studies now show that if you mix a lot of lidocaine, like the injectable lidocaine, with PRP, then what it's going to do is negate some of that PRP. It breaks it down artificially. So what we actually prefer you to do is to use a topical lidocaine that you can wipe off thoroughly and then hold ice to the area, and it does not hurt. Typically, you're charging about $1,200 for this procedure. The breast lift. The breast lift takes a lot, and it's a little bit of a beast. You've got blood sitting everywhere when you do this one. So with the PRP breast lift, a lot of times I'm using this in conjunction with PDO threads, so those barbed wire threads to pull up the breast and give you a lift. You're placing it along the cleavage and up behind the nipples. Behind the nipples, you're going to get collagen improvement, nerve improvement, so you're going to get more sensitivity behind the nipples, which is great for someone who's breastfed a lot of kids because they lose that sensitivity there. But when you place it along the cleavage here, it's going to give you more fullness to that area. Now, again, you can put some filler in the nipple to give it a little bit more perk as well. Typically, we're charging about $1,800 for this. Now into the joints, and that was all the cosmetic aesthetic parts. Into the joints, this is so important. The procedure for this is a little bit different, and we'll get to that at the end. But typically we're charging $750 for one shoulder. Can help with tears, arthritic changes, tenderness. Best results seen at 3 months. Crazy important that you understand that they can have no steroids at least 6 weeks prior to, no NSAIDs at least 2 weeks prior to. They're coming to you for pain and they want help. So you need to make sure you are going through those histories very well. When was the last time you had a cortisone injection? When was the last time anybody injected anything into you? Because they may not even know it was a steroid. When was the last time when you were on any oral pills to help with this pain? And make sure that there are no anti-inflammatories in there in order for this to work best. Carpal tunnel, $750 for one wrist. The knee, $1,000 for the knee. The ankle, $750 for an ankle. Plantar fasciitis, typically we're doing $500 for both feet with this. And again, this does an amazing job. So with the plantar fascia, we have that tightening along the fascia. So when you get up in the morning, it's really tender when you're stepping down on your foot. The other problem with this is that tendon or that fascia is going to pull so hard against the heel bone that you're actually going to get bone remodeling in there, and you're going to notice more heel spurs. So this does a really great job for us to be able to treat our patients with this plantar fascia. Within the elbow for lateral medial epicondylitis, and typically we're charging about $500 for that. Now let's run through the process real quick. Super easy to do. So you want to make sure you're getting your consents on your patients. Make sure they understand that this is autologous. It is their blood going back into their body. It's not anybody else's. It is theirs. Get photos of the area, especially if you're going to be doing a cosmetic issue. It's a very slow and insidious onset, so it's one of those things where the patients might not even notice that there's changes there. So it's really good to have befores and afters. Now, when I'm doing different joint injections, I also mark up that area. So for the knee, I make my little lollipop with my 2 circles on the side so I know that I'm where I'm going in at. With the blood draw, you need a lot, so make sure you're using a larger needle. You also need suction. So using a normal little vacuum container is not going to give you the amount of suction that you need. So using a plunger or a syringe is going to be better because you're going to activate those platelets more readily, so it's going to work better within the body. Prep the skin. Now when I'm doing the face, I'm usually using something like Puricin or a hypochlorous acid to clean the skin. When I'm doing a joint, it is a sterile procedure. So I am using a Hibiclens and I'm using iodine, and again, sterile procedure to help prep the skin in there. You want to make sure that you can transfer it into the correct containers. You want to weigh it accurately. It needs to be within 4 grams, otherwise it is not going to get the right kind of spin on it, and then you're going to get an imbalance and you're not going to get the right kind of breakdown of platelets. Now, the centrifuge that you're going to be using for PRP has to be made for PRP. You can't use your basic labs that you draw your CBC and CMP with. The other thing is the tubes are different. Some of those tubes have different additives in it that when you put it back into the skin, you're going to cause serum sickness in some patients. So make sure you're using one that is designed to be used for platelet-rich plasma. Now, you want to make sure you spin it the first time for at least 2.5 minutes. Then you're going to transfer that platelet-rich plasma into another tube. You're going to concentrate it down even further. And usually that one is going to spin for about 6 minutes. You're going to place this into your different syringes. And remember, if you're using sodium bicarb, that can be added ahead of time. If you're using calcium, it's going to cause a coagulation along those tissues. And so when you go to put that calcium in, you want to do it right before. Otherwise, you're going to have a hard time getting that to go through the needle. So make sure you're using aseptic techniques. Avoid any kind of biofilms. Remember, when we concentrate down that platelet-rich plasma, it is going to be very acidic. So it is going to burn in certain areas like the face and the breast. So make sure you prepare your patient. Tell them that the burn is only going to last about 2 minutes. Now, I'm not a super fan of using a lot of cool compresses because I need that inflammation in those tissues in order for this to work correctly. So, if you're going to use compression and it's cold, use it for just a few minutes. The sodium bicarb will help to buffer out some of the sting. So if you're using sodium bicarb, you're going to notice not as much of a sting, but you're not going to get that great thickening agent as you would with the calcium. So keep that in mind. And then, like I said, when you add in lidocaine into the mix, it is going to dilute and cause some of that platelet-rich plasma not to be activated as well. They are going to be swollen. This will hydrodissect down into the tissues. So you don't want to make their eyes so swollen that they can't see, or their anterior vaginal canal so swollen that they can't pee. but it is going to be swollen. And then after a little while, that's going to be absorbed back into the tissues. Now, it's really important that you educate your patients and you train them on what to expect and how to prepare this to go back into their bodies so that they get the best outcomes. If you have any questions or if you want to get in and train with us here at Empowering Health, give us a call. The phone number here, 812-290-2128, and we hope you have a lovely day.